Okay, so we're going to demonstrate how to take the bite using our new bite shims for the Moses appliance. And this is the Moses appliance. And so we have a new plastic bite shim. And these plastic bite shims have two sides. One side is smooth and the other side has projections, little dimples. And in front of the dimples are a ridge, a wavy ridge. And this wavy ridge is to retain the bite registration material. So what we do is, the reason we have the dimples so we can stack these together. We'll stack two together and we'll try them in. Gloria, open please. And we have her close her teeth together. And now we could say, close your lips please. And the issue is, we want her lips to be comfortably closed. We maybe use chapstick to make sure that the lips are nice and moist. And then we see, with the lips together again, we want to see no stress in the muscles of the lips. We want it to be a closed lip, unstrained position with the maximum number of shims that the patient can tolerate. That was easy, and 2 was just fine. No stress visible. So now we will do this again. We'll try 3 in. And so with 3, close, lips together. Again, nice, comfortable closure, no stress, no mentalis activity, hyperactivity. This is a good. 3 is easily tolerable. And we will then try a 4th. And it's also a good idea when you do this to ask the patient, open up just a little, now close. Okay. And you want to get this in far enough that it's not interfering with the lips. We don't want the shims themselves to interfere with the lips. Can you come? Is that comfortable for you? Mm-hmm. Can you handle it? Do you think you can sleep with your lips together with this vertical height that we've established? Mm-hmm. Good. Thank you. And so now we will try in one more. And when we try in the 5, we will now have 5. Again, put it in. Close your lips. And if you look carefully, if you can zoom in, you'll see that you're starting to see some stress in mentalis. You're starting to see a little freckling here like, and a little stress here, and you can see her lips starting to purse to close. So is that as comfortable? Is that comfortable for you? Mm-hmm. So it looks to me like we will use 4. When you do the 4, and these are nicely locked together so they don't float all over and they don't get in the way. Take one off, separate them at 2 and 2. Now we take, each one has a dimple outside, the male side, and the female side, which is totally flat. We take and put smooth side, female side to female side, and the reason we do that is so that these can then float and any which way, and we can use these once we have the anterior snugly in place to find the right bite. The point we want to emphasize here is that it's very important. The correct vertical height to record for the Moses appliance is the maximum vertical that the patient can comfortably keep their lips closed. The bite, the protrusive bite, is the maximum protrusive position that the patient can assume and comfortably keep their lips together. So, we will now extrude our first 2 ribbons of material. And when we extrude the 2 ribbons of material, we want to extrude a flat ribbon so there's as little interference as possible. And so when we do this, we want to engage the projection so that this doesn't displace itself in the mouth. And okay, and put it in. It doesn't make any difference, just close. Okay, and that's it. Now, that takes 50 seconds to set. While it's setting, we take a pencil and we can mark this is her upper midline. And if you'll give her a, that's exactly right. I've marked the lower midline. And if you can zoom, can you zoom in and see that line? So now, if we have 28 seconds left here, and then we'll have her protrude her jaw. Take the mirror, please. And now we've identified your upper midline and your lower midline. And I'm going to take this out, open please, and bite. And we can bite in your back teeth, please. And we can see that if we look carefully again, her mandibular midline is about half a millimeter to the right of the maxillary midline. And so we want to align these basically, if the midlines are off, we want to get this in a comfortable position, essentially upper over lower. And so we'll put this back in. Now find the bite, please. That's it. And now, is that comfortable there? Mm-hmm. Okay. And in fact, we've got the upper exactly over the lower. So we'll say, Gloria, would you please protrude as much as you comfortably can. Protrude, protrude. Okay, is that comfortable still? Mm-hmm. Okay, try a little more. Is that uncomfortable? Mm-hmm. Okay, go back to where it's comfortable. Is that, you got it there? And then I'm going to mark on both the upper and the lower, two surfaces, a fine line shows, and I'm going to connect the midline, and take the mirror and look now. It looks to me like you went off a little bit. No, just a little bit. No, not protrude, but line up the midlines in that protrusive position. Take a look, please. Looks like you could go a little bit, teeny quarter of a millimeter to the left. No, that's right. There. Is that okay for you? Mm-hmm. Okay, now, keep your eye, when you put the mirror up, on the lines, and now I will show you. We will now extrude the bite material with her looking in the mirror and holding in position. We will now extrude the material in the posterior segment, and as we come forward, I'm going to try and engage. There's a little retentive keyway there in the distal. I'm going to try and engage that, and I'm going to overlap the front. And I'm going to come to the other side and do exactly the same thing, posterior segment, and I'm going to try and extrude, and I'm going to push her cheek in there just a little bit to see if I can engage it, and then I'm going to overlap it and see if you can close your cheeks just a little bit. That's it. And now we wait the 50 seconds, and in fact you watch and make sure that you don't move. So, repeating just for the essence of it, the bite that we're trying to record is the maximum vertical that you can the maximum number of shims, the maximum vertical that you can comfortably tolerate, and the maximum protrusive that she can comfortably tolerate. And so this is the bite we've established here. And is that still comfortable? You're not having any pain. Good. And then we will have her open in 16 seconds. We'll remove it. Okay, open please. And that's what it looks like coming out. At this point, if you look carefully at this, you can see that there's soft tissue recorded in the interproximal areas. When you send this to the lab, if you really want to be certain that it's going to go down on the casts are going to go down on it, do not include soft tissue. Soft tissue is soft, and so it will move, and it will cause distortions. All we want in the bite is hard tissue. So we take a laboratory knife, and we will cut off. All we want is occlusals of teeth, and we cut, and that's the plan. And hopefully, when you trim, if if you want to make your assistant really happy, you don't trim as messy as I am. You trim neater so that there's nothing on the floor. And if you're filming it, you never look at the camera when you're cutting with a scalpel. Okay, so close and see if you can find that bite. Is that comfortable? Mm-hmm. Okay, and there we have it. And so open, if you would like. We can show you that's what it looks like. Trimmed on the one side, trimmed on the other side, basically flat. All we want to do is eliminate soft tissue. If we put it in one more time, just for a second, this bite, she's limited in closure to the anterior segment. The hard shims limit the closure. So this is actually a temporalis dominant bite because the temporalis, the muscle that's in the front, is the muscle, the elevator muscle, the power muscle that's limiting closure. And so this is a temporalis dominant bite. This is our main bite. This is the bite we use about 95% of the time. And open up. But I want to show you another bite.